So hi, this is State Representative Todd Stephens. I'm here with Rich Roberts of Volunteer Medical Service Corps. And Rich, thanks so much for taking the time to join me today. Um, yeah, one of the things that I've come across here in my legislative district is, just a real, right now everybody's so stressed. They're focused on, their own lives. They've got kids at home from school. Maybe they're out of work and, just trying to keep their own lives together. And they may not fully understand what our first responders are going through right now and the impacts that this coronavirus is having on our EMS services across the board. And so I thought it'd be a good idea you and I could maybe have a conversation to help let people behind the curtain, if you will, and understand what our folks on the front line are experiencing. So thanks for taking the time today to help with that.
Absolutely.
So, just out of the gate, I represent, 4 communities: Horsham Township, Upper Dublin, Lower Gwinnett, and Montgomery Township. And could you just provide a little bit of, just give me an overview for the folks that don't know what VMSC is all about and who you serve and how large you are, that type of thing?
Sure. So VMSC, Volunteer Medical Service Corps, Lansdale, we represent the EMS providers for the greater North Penn region. We cover Montgomery Township, North Wales Borough, Lansdale Borough, Upper Gwinnett. We cover a good portion of Worcester Township, Talmenson Township, Hatfield Borough, and Calmer.
Wow. All right. So you guys got a pretty big footprint. How many folks you have up there, and you have a mix, right, of volunteers and full-time staff?
Yeah, we cover approximately 58 square miles. We cover that with approximately 60 career staff employees. Some are part-time, some are full-time. We have approximately 40 volunteers. Out of that 40 volunteers, they're split. Some of our volunteers are purely EMS. Some do our special operations or rescue and EMS. So we have some that maintain our canine search and rescue team, as well as our EMTs or paramedics. And we have some people that just are straight EMT paramedics. And we also have some life members that come around and help basically do the logistical support stuff during calls, during large events, and help out just around the building where we need them to be.
That's great. So I know you and I have been talking over the last several weeks here. I think you said you do over 800 calls a year. Is that right? Ambulance calls?
Over 8,000.
Oh, I'm sorry, 8,000. Yeah, over 800 a month.
Yes, correct. We can go between the high 6s to the low 8s, depending on what time of year, what kind of season we're in, and what kind of events are going on.
Got it. Okay. Well, that's great. And thanks for all you're doing out on the front lines. That's for sure. Let's just talk a little bit about this pandemic and how it's changed life. Obviously, the life of someone in your role and the men and women that are working with you is stressful enough. What are some of the special challenges that your organization, and even more importantly, your folks on the front line have been experiencing over the last several weeks during this pandemic?
Sure. So one of the biggest things is getting used to wearing personal protective equipment almost daily, 24 hours a day, conditioning our bodies for a 12-hour shift that is different than the last 12-hour shift that we've been used to working, conditioning our bodies to be under the pressure of wearing a mask, wearing a face shield, wearing goggles, wearing isolation gowns that don't allow your uniform to breathe, and also conditioning your mental stability to be handling that while you're also handling an already critical patient or a scene that could potentially be chaotic or has the potential to go chaotic. And you want to protect yourself, you want to protect your partner, you want to protect the patient, and you want to protect the public. And that stress of all of that seems to just be wearing down on responders everywhere, from EMS, fire, to police.
Sure. Let's talk a little bit about that personal protective equipment, because this has been a conversation that I've been having with my colleagues across Pennsylvania over the last several weeks, and as recently as this morning. Some of my colleagues in other parts of Pennsylvania where they haven't been hit as hard as as our region has been hit with this coronavirus, they don't, as far as they're concerned, there's plenty of protective equipment out there. Now, you had shared with me, I think maybe a week or so ago, some of the lengths you were undertaking to find alternatives because you couldn't find, protective gear for the head. You were out looking for shower caps, I think. And I think you talked about, rain ponchos from Amazon because you couldn't find the appropriate gowns for your folks to wear. Can you let folks, fill folks in on what you're lacking and, what lengths you've had to go to try to protect your staff that's out on these ambulance calls?
Sure. So our staff at a minimum is wearing an N95 mask and medical gloves on every call. When we have a possible exposure or somebody that presents themselves with a possible exposure or people that are letting us know that they have tested positive, our staff is wearing facial shields. They're wearing goggles, same kind of goggles you would wear in high school, chemical resistant goggles, so that we're splash protected. They're isolating their entire human anatomy and basically covering themselves so that after this call they can go to another call and potentially don the same equipment. So they're wearing isolation gowns that cover them from their collar line down to almost their calves. They're wearing sleeves on top of their arms if they're wearing t-shirts. These gowns don't breathe. Some of them are a cloth moisture wicking. Some are just flat rubber. Some are plastic. Some people are wearing Tyvek suits. So now you're taking an ambient outside temperature and raising it by potentially 30, 40 degrees. And so now you're dealing with how you're going to decon this gear, whether or not you can decon this gear, and whether or not this gear is going to stay intact while you're working on the operation that you're working. A lot of this stuff is protective from the outside, but not protected from the inside. So as providers start sweating, we're seeing some materials that can't hold up to that from the inside, and they're starting to tear. So that's compromising them. As far as finding the gear, we've been very fortunate. We stretch out our arms as much as we can. We communicate with other squads. We've obviously reached out to you and your staff and said, hey, this is what we need. Isolation gowns are very hard to find. We've had to kind of think outside the box. The biggest thing for an isolation gown is covering you from the collar down to mid-calf level. Rain ponchos with sleeves we found were working, pretty good, but now you're basically putting yourself inside of a trash bag and you're creating even more heat. Traditional ponchos don't work because they're open in the arm area, so now you definitely have to put on another set of sleeves. But again, we could take what we can take, so we've ordered sleeves, we've ordered traditional ponchos, we've ordered rain ponchos, we have our Tyvek suits. We are looking at protective masks, surgical masks for our staff, for the patients. If we're dealing with a pediatric patient and mom and dad need to ride along, we need to make sure that we provide them with a mask. We need to make sure that the mask that they have is appropriate for them. Everybody's got a different size face. So, if mom and dad have a mask, we're checking that to make sure that that's appropriate for us so that they're safe in our truck and we're safe around them. We have suppliers that are consistently changing their prices, whether or not it's truly something that they can't get a hold of materials, or whether or not some people are taking advantage of this. We see it on the news every day. We see the price of some goods going from $3 to $12, and they turn around and they tell you that the supplier has 10,000 in the lot of it, and then they're only selling, even to emergency services, they're only selling lots of maybe 100 to 200. So we struggle at getting that. The county of Montgomery, I've got to imagine, is struggling to get that because they've got a lot of people to take care of. So we've tried to do as much as we can. We've reached out to hotels in our area. We were gracious enough to get a very large donation of shower caps to help protect our responders' heads. We were able to get a great donation of protective masks due to your office and providing them for our providers to make sure that the patients are taken care of. So every day we're constantly surfing the internet. We're constantly talking to other squads. We're talking to supply houses that we've never had to talk to. We're talking to paint shops. We're talking to Home Depots. We're talking to auto mechanics that may know a guy that has a friend that has an idea of how to get gloves. So we've really stretched outside of our normal, this is our supplier, this is where we buy things from.
Yeah. You just raised gloves, and I know that's something you mentioned to me in one of our, I forget if it was a text or a conversation, but an issue versus latex gloves versus medical gloves. Can you expand on that just a little bit and tell me what's going on there?
There's a lot of people in the community that have latex allergies, and some of those have been discovered, and some of those have not been discovered. The nitrile medical gloves that we wear on a daily basis, we don't see people with allergies on those. So that's what it's safest for us to wear as providers, and it's safe for the community for us to approach people with. We know that there's no issues or very, very minor issues, if that. Where a latex glove, we're already there for an emergency. We don't want to create a second one.
And so I think you were saying that, as you would put requests in to the county and some of those requests, and it's not meant to be critical at all, because I know, as you said, everybody's stretched thinly, but you'd put in requests for medical gloves and get latex gloves back, I think is what you were sharing with me. And that's just not a proper protocol, because that violates Pennsylvania Department of Health regs as it relates to ambulance personnel. Am I right there? That's one of the challenges you're running into?
Correct.
Yeah. And that is something that I've run up the chain, and we're trying to get resolved. I've asked them, what I don't want them to do is stop giving you gloves altogether. I'm just trying to get you the right gloves so that you can properly protect your patients and their members. So through all this, you guys are obviously exposed to so much. How are you doing with staffing levels? Are you running into any issues there?
So our staffing level have been pretty good lately. Across EMS, staffing has been very hard over the last couple of years. We just cannot attract young population to want to go to school for emergency services in general. The days of the fire academy being full of people trying to get educated has slowed down. We're constantly looking for the next person that wants to join our organization, and we can help push them through the education system to get their EMT, to get their paramedic. But in whole, we've been fortunate, I think, across all of Montgomery County that our staffing has been satisfactory. We're able to staff our trucks. We're able to get them on the street. We're able to provide services to all the communities. We're able to support other squads when they're out on calls, and vice versa. Other squads have been able to support us just fine.
Yeah, well, that's great to hear. One of the other issues that we keep talking a lot about in Harrisburg is testing. And trying to make that more available. A lot of organizations are contacting me concerned that they can't get tested, particularly when they have someone who may have been exposed but is still asymptomatic. And, you don't want to put them back in an ambulance with another patient if you don't know that, whether they may be carrying around this virus. Are you running into any issues with testing, or are you guys, comfortable with what's going on there so far?
So we really don't have much to do with testing when it comes to that being in the field. If you present with a positive test, we ask that everybody to, please let us know that. We're looking at the diagnosis, and looking at the overall spectrum of what the patient presents us. And that's how we decide what PPE is appropriate for this. We're giving the hospitals a heads up that we're coming in with somebody so that they can be prepared for isolation and so forth. The hospitals then are really the people on the front lines of the testing. I'm not hearing anything critical when it comes to people being tested at the hospital that we bring in. As far as the general public getting generalized testing, we've been so busy trying to capture other items. We've heard some people in the public have reached out and said, are we doing testing in-house? We do not offer any of that testing in-house. The best thing to do is contact the Department of Health, go through your family doctor, allow the professionals that have that information to disseminate that to you.
How about for your staff? Have you run into any problems getting any staff members that, may need to be tested?
No, so we have had a couple staff members that have had some possible exposures. The Department of Health has been rock stars with it. We have a direct line to Department of Health in Montgomery County. As soon as we call and tell them that we have an issue or something, we're getting one-on-one correspondence with them. They are going direct with our providers and making sure that our providers are getting tested in a very timely manner, and the results are coming back at a very good time.
That's great. That's terrific to hear. So let's talk about some of your costs. I'm sure you're running on a pretty thin margin on a good day. How is this impacting your costs and really your ability, that ultimately will be to carry out these services, for the future, for the long haul?
So our organization, specifically our board of directors, has been a very solid board of directors for the 10 years that I've been there. Very focused on financials, very focused on investing. We've been very fortunate to have some really smart leaders on that side of things. And they've always kind of made sure that we've had the quote unquote rainy day money set aside. We've always had, something in case we've ever had this issue. I think the biggest concern here is that this is not a blizzard that's going to roll through in a weekend. This is not a hurricane or a tornado that's going to last a week long. We're going on week 6 and 7 right now. We saw supply costs go up really high in the very beginning. We were hoping that maybe they were going to start to drop down a little bit. We haven't noticed a drop really in anything. We've noticed some supplies becoming a little bit more readily available, but the price increase has stayed. So, when we were looking at it, N95 masks, as an example, we were purchasing them for less than $2 a mask. We're now looking at, hopefully finding providers between $5 and $7 a mask. So now we're looking at, purchasing permanent PPE and distributing that to our staff so that they have reusable respirator masks so that they can wash them, clean them, disinfect them, and reuse them. But again, we're waiting on manufacturers to release that, and then we're going to have filters that become available. So where a provider may have used an N95 mask once or twice a month, we're now using an N95 mask probably a dozen times a day per provider. Where, we have 8 providers on at a time. So 6 times 8 times 12, it starts to really boil out of control there. So we're hoping that as facilities get turned back on and realize the stock and the supply that they have, that some of these suppliers will start to resupply and bring these numbers back down a little bit more. That's the big thing that's costing us. We have made some purchases that we did not plan on making this year. We purchased a hydrogen peroxide fogging machine to really sanitize and disinfect our ambulances. Yep. A large number, an expensive purchase. However, we need to do what's best for our providers, and we need to do what's best for our patients in the community that come in and out of our ambulances. And traditional wiping down is great, but to have that scientific stamp of approval on the ambulance and know that we've properly cleaned it. But again, there are expenditures that we did not plan on making this year. We have a decon tent in our parking lot. So we have an actual tent that we've rented. We've put sanitizing solution in there so that crews coming in and out of Lansdale Hospital have a safe place to clean their ambulance before maybe they have to drive back as far as Skipback or Harleysville or drive back down to Horsham. They have the availability to drive 50 feet away from where they just dropped the patient off and scrub things. We have so far, the Volunteer Medical Service Corps so far have paid that entire expense just to try and help watch and protect our brothers and sisters out there to make sure that they are going home to their families.
Yeah, that's terrific. That hydrogen peroxide, fogging desanitization or sanitizing machine. I know that some other departments were looking at those. They're around $30,000, if I remember correctly. Is that
correct?
Yeah. And so, look, it's great technology, right? Probably came from Horsham, if I'm not mistaken.
We were not able to get ours from Horsham.
No, all right.
No.
Well,
we tried to, but again, we've got to go with what's readily available. And there was a very smart man in Horsham that grabbed the last one, I heard.
I got it. Well, look, I want to give some folks some idea here. What can we do as residents to help make your life easier and safer? What can we do?
Sure. So, and I'll start with something very simple across the entire emergency services basis, whether it's for EMS, police, or fire. If you initiate 911 and you have the availability to meet us outside, that is the safest thing for us. Obviously, if a police dispatcher or a fire dispatcher or an EMS dispatcher tells you otherwise, listen to them. However, if you have the availability to meet us outside, even sitting on your steps, something so that you're in the ambient air, that is going to help cut down any kind of spread of this. If you're able to move the patient outside for us, that's going to help. If your household has a large amount of family members and we can move the majority of the family members outside so we can lessen the threat when we come inside your home. That's a huge help. Opening up doors and windows prior to our arrival to get some fresh air in there is great. If your loved one can't come out and you can have somebody sit with them and then have everybody else wait for us out front. We don't want to abandon the patient by any stretch of the imagination, but we also do want to make sure that we're, providing a safe environment for all the emergency responders that are coming in and out of the house so that we're all safe at the end of the day.
Well, it's certainly great to hear, and I think that's something we can all live by. I'll try to push that out through our social media channels just to let everybody know across the board that's a way to help limit the limit the exposure for your folks who are on the front lines. Rich, I've spent enough time with you today. I really appreciate the opportunity to talk to you and let let the folks understand what our frontline EMS personnel are dealing with on a daily basis through this pandemic and how we can help. So thanks for all you're doing. Please send my regards to the rest of your crew down there. And, as you know, if there's anything I can ever do, shoot me a text, give me a call. I'm happy to help with anything I can, and stay safe. All right.
Thank you. Appreciate your help.
All right, Rich. Thanks so much. Take care now.